Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
I told you that the most important doctor's visit you'll have this year is the one that you're probably thinking of canceling. You have no symptoms, you're not in pain. In fact, you're probably feeling great. And that's exactly when health issues like heart disease, cancer, diabetes, and high blood pressure are ready to begin their assault. Today, we're going to tell you why it's so important to make time for your annual physical exam, as well as answer your questions here on Ask the Doc. No appointment needed. Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your health questions. I'm Dr. Kamaljit Kaur, a concierge primary care physician here in South Florida. Let's get right to our questions. Today, our first question comes from Dash, and Dash is reaching out to us through allhealthtv.com asking, "Hi, Doc. I'm a relatively healthy man in my mid-50s, and I want to know why I should get an annual exam. Do I really need one if I'm feeling pretty good?" Hi, Dash. Thank you so much for reaching out. And I am glad that you asked this question because this is really important to think about. And I'm glad you're thinking about it because, yes, you may be feeling absolutely fine. And you may even be thinking, I don't really need a checkup. Everything's okay. And that's exactly why we want to have these kind of exams, because even though you're feeling okay, to know that you truly are okay on the inside and that all your health components are working at their best, we need to have physical exams at least once a year to really get a comprehensive overview on your health. As a primary care doctor, my main concern and one of my primary goals is to make sure that I help my patients prevent disease. And to do that, we need to screen for disease. And how do we screen for disease? Through annual physical exams. And in order to do that, there's a lot of things that we look at during your annual exam. We analyze certain components of your health. We ask you how you're doing. And we put this picture together to really find out if you are as healthy as you feel. Let's go into a little bit more detail by exploring the top 4 reasons for getting your annual exam. One of them is early detection. And I don't want anyone to overlook this because this is probably one of the most important. What do we mean by early detection? Well, early detection of disease. Remember, I said that primary care physicians and your annual well exams, these are all components of your health care to ensure that you stay healthy. And one of the best ways to do that is to detect diseases early, especially if these are preventable diseases, which majority of diseases can be. So how do we detect disease early? Well, during your annual exam, your doctor may order certain blood tests or imaging tests to screen for common diseases that we see in certain age groups and certain genders. And these tests are meant to pick up any small abnormalities that may hint to us that a particular disease is developing. And if we're able to detect it that way, then we can put in a plan of action and really tackle it and prevent it from getting worse or turning into a life-changing or life-threatening disease process. The other reason is to establish baselines. So when you're feeling healthy and you truly are healthy, that's actually one of the best times to establish your baseline. And what do I mean by that? Well, what is your baseline blood pressure? When you're 16, your blood pressure is one number. And then when you're 30 or 40, and as you age, your blood pressure will change. So your baseline changes. But it's good to trend that over time to see what your norm is, because what's normal for you, especially when it comes to things like blood pressure, may not be normal for everybody. Everybody has different mechanisms in their body. Everybody's genetic makeup is different. So establishing your particular baseline is very important. Now, even though blood pressure is something that's variable, there are other components that we need to establish baselines for that are not variable. For instance, sugar levels, cholesterol levels, thyroid levels, electrolyte levels, vitamin levels, and checking for autoimmune diseases, things like that. If we can establish a baseline for you and know what is normal for you and, for majority of individuals at your age and at your gender, then we know when to look for abnormalities or when to see something as an abnormality and say, hey, this is not good. This might be an early part of a certain disease, and hence going back to that early detection. Another reason is you want to build a relationship with your physician. Your physician is there to, like I said, care for you, help you stay healthy, and prevent any major diseases. And if you do have chronic conditions, to make sure that they're stable and they're not going to cause complications. One of the best ways to do this is for you to talk to us. So when my patients come in, absolutely, there are things that I'm looking for and things that I know I have to go through. But I really also rely on my patients, because it's a collaborative relationship. I rely on my patients to tell me, hey, doc, I'm not feeling so good, or I feel like this is happening, or can we talk about this? And in order for my patient to feel like they can talk to me, we need to have a relationship, because you wouldn't talk to somebody that you don't feel comfortable talking to, especially about something so intimate as your health, right? So building a relationship with your physician is going to cultivate that type of environment. So when you go in to see your doctor, you are comfortable telling him or her that this is wrong with me, or that is wrong with me, or I'm not feeling so great in this aspect of my health. So I think building that relationship is really, really important. And, heaven forbid you get a life-threatening or a life-changing diagnosis. Your primary care physician should be your advocate, your quarterback, the person that's going to be in your healthcare corner, so you don't feel like you have to go through anything alone. And again, all of this really depends on a good, trusting relationship that goes both ways, by the way, between you and your physician. Also, one thing that we tend to forget or minimize a lot, and we shouldn't, is mental health and well-being. Yes, when we look at your lab tests and we look at imaging tests and we check your blood pressure and your weight and all that stuff, we're looking at physical aspects of your health, which are very important, of course, but just as important, if not more important, is your mental health, your spiritual health, your emotional health, your overall well-being. You can't really have one without the other, and you can't have, some of them and ignore one of them. It's a holistic view that we need to have of your health to ensure that we are optimizing it and really setting you up for success to live long, live healthy, and live happy. So mental health is very important. And again, this goes back to number 3, building that relationship with your physician is important so you can be comfortable discussing your mental health with him or her. I hope this helped to answer your question, and I hope you have a successful and clean bill of health after your annual exam. All right, let's get to this next question. This one comes to us from Summer, and Summer has reached out to us through YouTube asking, hi, Dr. Kaur. I don't remember the last time I had an annual exam with my primary care physician. What can I do to prepare for it? Are there specific tests or questions I should request? Hi, Summer. Thank you for sending in this question. And this is a fantastic one, because you're right. There's a lot of stuff during an annual exam that your doctor is probably going to talk to you about, but then there's stuff that you should also be looking out for, or that you should be asking, or maybe you want to be asking. I'd like to emphasize how important it is that when you go in for your physical exam, you are well prepared, because you want to get the most out of it, especially if you're an otherwise healthy individual and these exams are happening just once a year. Having a plan to discuss with your PCP allows the two of you to better collaborate and ensure that your health is being adequately cared for. The exact questions and topics that you want to ask and talk about will differ depending on your age and in general your gender as well. Some basic guidelines are: ask which health concerns or diseases you are at most risk for. And this may depend on your personal health, your lifestyle. For instance, do you smoke or drink on a regular basis? Or have you engaged in any unhealthy habits in the past? Your own health history in the past. Maybe you had certain diseases or conditions as a child that should be monitored. And also very important that a lot of times people forget is your family history. So it happens a lot when I'm talking to a patient, especially when the first time I'm meeting them and we're going over their annual exam and all these health factors, and I start to ask them about their family history, particularly if their mom, dad, or if their siblings have any type of health conditions that are either genetic or can have a bearing on their health. And oftentimes it happens, and I never want them to feel bad about it, but it does happen a lot of times that they don't know the answer. So they'll call their mom or they'll text their mom while we're sitting in conversation, and that's totally fine. But just know that when you go in for this exam, your doctor is going to ask you about yourself, but it's very important to know what your family history is as well. Also, you should ask how to screen for those diseases that you're at risk for. For instance, if you're a woman over the age of 40, we're going to start talking about breast cancer screening and how to screen for breast cancer, mammograms, ultrasounds, MRIs. There's a couple different modalities. And while mammograms are the first line and gold standard, there are certain instances in which an MRI might be indicated or an ultrasound may be indicated as well. So it's very specific. And again, it's very specific to not just your gender, but also your age. And you're going to want to ask what diseases are pertinent to you and how to screen for them and what testing should be done so we can early detect things or we can help you prevent things and really stay as healthy as you can be. Another important topic to discuss is vaccinations. We have some very effective vaccinations to help prevent a variety of diseases, infectious and otherwise. For instance, flu, which commonly everybody knows about, COVID-19, the shingles vaccine, and even a vaccine that helps prevent HPV-related cancers. Oh, and let's not forget tetanus. I know that's one that everybody always forgets because it's generally indicated once every 10 years, unless you nick yourself on a piece of metal or, a rose thorn if you're gardening. So tetanus is one of the ones that 99% of my patients completely forget about, but that's what we're here for, to help remind you to get that. Once the prevention conversation is complete, then ask, what is your current health status? So what is your blood pressure? And how does that compare to the blood pressure of other individuals in your age group, with your health personality, I'm going to call it, with your health history and your current numbers? Also, how is your cholesterol? How is your blood glucose? How is your weight? You want to know what your current picture of health is as well, so that you know if you're going in the right direction or if there's room for improvement in some of the factors. After all that, you want to talk to your doctor about formulating a plan. So together you'll sit down and you'll determine what you need to do to screen for disease, what you need to do to prevent diseases, and what needs to be monitored or followed up on a regular basis. For instance, if you're somebody who has a history of thyroid disease, you may need your thyroid levels checked every 6 to 12 months. You may even need an ultrasound. So there's different things that'll come into play depending on your own health history. Lastly, but not least, absolutely not least, I'd like to highlight that we often get caught up in things physical health and what numbers look like and all that stuff. But addressing our mental health, as I mentioned a little bit earlier, is also very, very important and should be discussed during your annual exam. Actually, it's one of the best times to do it, to be honest with you. If you've been experiencing any mental health symptoms, any anxiety, any depression, especially if you feel like it's interfering with your day-to-day activities, this is certainly something that you can and should bring up to your during your annual exam to your physician, because like I mentioned, your health is holistic, or it should be holistic. So mental health, physical health, spiritual health, and emotional health are all very, very important. I hope this helped to answer your question, and I hope this gives you some good guidance for your upcoming physical exam. All right, let's get to our next question. This one comes to us from Rosario, and Rosario has reached out from YouTube asking, "Hola, Dr. K. Kinds of screenings or tests are typically included in an annual checkup? I'm asking because I recently graduated, started a new job, and have health insurance for the first time, which also makes me wonder, are annual exams usually covered, or can there still be out-of-pocket costs?" Hi, Rosario. Thank you for asking such an important question. Congratulations, first off. Congratulations on graduating, getting a new job. This is such an exciting time. And I'm so glad that you're not letting your health go to the wayside or the back burner. It's really important that the earlier we start taking care of our health and monitoring it, the better we are going to be suited to set up for long-term good health. All right. So to answer your question, as I mentioned earlier, exact testing is going to differ on your age and your gender. So between men and women, a lot of the tests are similar, but there are some differences. And of course, because of age related issues and some diseases coming on at certain ages that we see more often than others, they're going to also warrant what's going to need to be tested and what's not going to be needed to be tested or can be tested later on. So since you said you just graduated and you just got your first job, I'm going to assume that you're under the age of 30. So I'm going to tailor my answer a little bit towards that. Now, the very first thing that's going to get checked during your appointment is going to be your blood pressure, your vital signs. So your blood pressure, your temperature, your blood oxygenation, your respiratory rate, and if you are a woman who is regularly menstruating, they're probably going to ask you when your last period was. So a couple simple things like that are going to be first assessed and then evaluated by your doctor. Now, in adults, we have specific ranges that we expect for all of these, for temperature, for blood pressure, for heart rate, for blood oxygenation. And if we see something that's outside of those normal ranges, we always want to evaluate it. And the first question is why? What's going on? So for instance, if you go into the room, you're a little bit nervous and the nurse does your blood pressure and your heart rate, and both of those items are elevated, because you're a little bit nervous doesn't necessarily mean that you have disease. But again, that is one of the first things that your physician will look at to determine where we are right now at this moment and what's going on. After you and your PCP have a thorough conversation, as I outlined a little bit earlier, then your doctor is going to perform what's called a physical exam. And during this physical exam, we assess different parts of the body to see if they are working normally, if they look normal, and if they feel and sound normal. For instance, we'll listen to your heartbeat, we'll listen to your lungs and make sure they fill up nice and big with air when you take a nice big breath, that there's no restrictions there. We're probably going to feel down your spine to make sure it's nice and straight. We'll feel around your neck for lymph nodes and to make sure there's no abnormality or swelling. We'll probably feel your thyroid as well. And we'll feel your belly to make sure that it's nice and soft, that there's no what we call guarding or tenderness. You're not having any pain. And the sounds that are coming from within the belly are what we consider normal. A lot of times when you go into your primary care physician's office for your annual exam, you are probably going to be fasting. And if you're fasting, it's probably going to be a bit quiet down there. So things that we know that you may not necessarily know, but don't you worry, we're looking out for them. And then we're going to feel your pulses to make sure that they're nice and strong, especially in your feet, because those are the farthest from the heart. So we want to make sure blood flow is good. We will probably look at your skin to make sure there's no rashes or anything like that. So all in all, we're going to do a thorough physical exam to make sure that everything looks, sounds, and feels the way that it should. Now, assuming that your vital signs and your physical exam are completely normal, your PCP will probably order some lab work for you and to see what's going on inside for an overall internal assessment. So what are we going to order? Usually we're looking to screen for anemia, diabetes, cholesterol, thyroid disease, autoimmune disease. We check some vitamin levels. We check your electrolyte levels. We want to make sure your liver and renal function or kidney function tests are looking good. We also look at your CBC for some of your immunological factors to make sure that's all doing well. So it's a pretty comprehensive lab assessment that we'll do to make sure that all systems are up and running as they should be. Now, as much as this is going to depend on your current health and your most recent health and health risks, don't forget about that family history, because that's going to make a huge difference in a lot of this as well. As you can see, your physical exam is meant to be a very detailed assessment of your overall health. And we start this with basic tests. I know the tests that I just named may sound a little more than basic, but we start with a certain outline. And then if we find abnormalities, then we'll go and narrow our suspicions, we'll narrow our assessment, and maybe order some more testing or follow-up tests, or even send you to a specialist to see why certain abnormalities exist if they are what we call clinically insignificant. Now, one thing I always like to point out with annual exams is sometimes we do a good amount of blood work, and sometimes we'll get some abnormalities back. But doesn't mean that those abnormalities or the ones that show up as red on your lab report are necessarily clinically significant or indicative of an actual disease process going on. I'll give you an example. So for renal function, we check what's called your creatinine levels in your blood. And creatinine is a good marker of renal function because when it's elevated, that means that your kidneys are not filtering things out the way they should be, or not cleaning the blood or filtering the blood the way it should be. That is a very simple explanation for what actually happens, but that's what it means overall. Now, if your creatinine comes back a little bit high on your annual exam labs, it's probably because you were fasting for those labs. Maybe you were a little dehydrated and you didn't drink enough water, and you hadn't eaten or drank anything at all for the last 12 hours. So depending on the context of your clinical picture, we will assess those labs and abnormalities to see, is this really indicative of her renal function being off, or is it just because she was dehydrated? So in that case, your doctor might say, hey, let's just repeat the labs. Well, you're nice and hydrated with water and you're not fasting. And majority of the times that does tend to come back normal. So what I want to say is that even though there may be some abnormalities, it's not always scary. It's not always indicative of a disease process. So do talk to your doctor for the reassurance and for the next steps in the plan to make sure that your health is being addressed correctly. All right, our next question comes to us from Logan, and Logan has reached out through Instagram asking, Dr. Kaur, I'm about to travel to Europe for an extended sabbatical, and my health insurance doesn't cover me while I'm outside of the US. I'm overdue for my annual physical, so I wanted to get your thoughts on whether a telehealth visit makes sense. Hi, Logan. Thank you so much for sending in this question. And it's a very relevant one because now with a lot of people working remotely and traveling all the time, they may not necessarily be readily available to go into their doctor's office physically for their annual exam. So I know telehealth is being used for a lot of different things nowadays. And while it is an absolute great alternative for certain health issues to be discussed and addressed, it's not a replacement or even same or similar to being in your doctor's office physically for your annual wellness exam. And I'll explain a little bit about why. So with your annual exam, as I've been talking about today, there's a lot of different parts of your health that we want to assess. And the majority of that requires you being in person so the doctor can actually assess you, listen to you, check your blood pressure, and all those kind of details that are really important that can really only be done in person. Now, I say that, but then I also know that there's been a lot of advancements in technology, especially after the pandemic. There's been a lot of creation of what we call remote patient monitoring devices. Then there's also those home blood pressure cuffs that somebody can get and other devices that can be bought over the counter even and can be taken with you when you're traveling to see and assess certain parts of your health. So that being said, those are great to have, but they're not a replacement for the validated devices and techniques that we have when we're actually in the office. If you can't get to your PCP's office though, and you are absolutely not going to be able to, better than missing your annual exam is to at least do the telehealth visit. So at least you and your physician can have a conversation about health and how to prevent certain diseases, what you should be screening for and what you should be looking out for. And if you do have any of those remote monitoring devices, then maybe you and your physician can evaluate them to see if they're validated, if they're actually effective, and maybe those can be used in order to complete some parts of the assessment. But overall, a telehealth visit on its own, it shouldn't be considered the equivalent of being in person in your doctor's office. I wish you safe travels, and I'm a little bit jealous, to be honest with you. I hope you stay happy and healthy over there. Let's get to our next question. This one comes to us from Elijah. And Elijah asks, Dr. Kaur, my father moved in with us a few years ago after my mother passed, and as it turns out, we're both due for our annual physicals. It got me wondering, just how different are these exams for a 45-year-old man versus a 70-year-old man? Hi, Elijah. Thank you for sending in your question. And thank you so much for being vigilant about this. Many aspects of the physical exam are similar in 45 and 70-year-old men, but a lot of them are different as well. A lot of the blood tests will be the same, but some of the questioning and physical assessments that we do may be different. For example, in yourself, a 45-year-old male, the focus is going to be on preventing disease and catching what we can early, while in an elderly individual like your father, the focus is more going to be on managing chronic conditions that may be present, preserving his physical health and his mental health, screening for dementia, screening for certain physical disabilities as we age. Your annual exam may include screening for prostate cancer, which sometimes is discontinued after the age of 69 in certain men. So that's going to be a little bit different as well. Vaccines may also differ. For instance, your father may also be advised not just to get the flu and COVID vaccines and tetanus, but also RSV, pneumococcal pneumonia, shingles vaccines. So that can be different as well. I think it's great that you're taking care of your dad. And one of the things that I also want you to look out for that we see in elderly patients, especially after a spouse passes, is loneliness and mental health. So I hope that's something that gets addressed too. Good luck to both of you. And I hope you guys stay happy and healthy. That was a lot of great questions today, and I hope I was able to answer them and give you guys some great information. Again, my name is Dr. Kamaljit Kaur, and it's been a pleasure. I look forward to answering more of your questions in the future. Have a wonderful day. Stay happy and healthy, everyone.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.